I'm a clinical nurse specialist in psychiatry. I've been at the VA for 35 years. Worked most of that in post-traumatic stress disorder.
I'm a BSU senior and an Iraq War vet.
I'm 25 years old. I'm a Boise State student. I served in Iraq from 2006 to 2007 as a combat medic, and also in 2010 through 2011 as combat medic.
So I'm a soldier, but I actually have PTSD through a civilian episode.
PTSD is considered a normal reaction to abnormal situations. It's not really a disease, but a disorder of avoidance.
PTSD is basically a variety of conditions brought about by extreme stress or shock.
Signs and symptoms of PTSD, just quickly we divide it sort of into three groups. There's the re-experiencing, which would be the nightmares and flashbacks and intrusive thoughts. And there's the avoidant symptoms, which is, basically depression, inability to have intimate relationships, keeping a lot of distance from other people, is arousal. And this would be outbursts of anger, trouble sleeping, trouble falling asleep, staying asleep. There's a lot of connections between people not wanting to go to sleep because of the nightmares that they might be having, and they don't feel like they're ever going to get beyond that.
There's a lot more minor cases than major cases. Their specific symptoms were a lot of drug and alcohol abuse.
Basically, it's diagnosed a couple of ways. We have a rating scale, the CAPS, the clinician-administered PTSD scale that we do. It's a series of questions around those symptom clusters that I told you about. We talk about frequency and intensity, those sorts of things. And just pretty much from a clinical interview and the history that the patient gives you.
The main way that they screen for it is that they just ask you. And soldiers have to be honest about it. Otherwise, the whole system doesn't even work.
The Army typically screens for PTSD post-deployment, either just before leaving the combat zone or just coming home. Typically, the screenings happen in the first month or so, but after that, they either have post-traumatic stress or don't, as far as their screenings go. There's a lot of online surveys, a lot of single forms, how do you feel, 1 to 10. Screenings caught very few because oftentimes it takes a while for it to manifest itself, or really the symptoms to come out.
Primarily with therapy, the VA's push now is to get them treated as quickly as you can so that we don't end up with guys that are 90 years old who are just coming into therapy for the first time. There's a thing called cognitive processing therapy where we help people look at the trauma and look at how they're avoiding it and have them really approach it, because avoiding it there's a quote that says, "What we resist persists," and that's certainly true with PTSD.
Nowadays, PTSD treatment consists of a lot of emotional support, a lot of physical activity, things like running, yoga, other forms of exercise, and they're finding that a lot of these more simple things are actually a lot more effective.
2 years ago tomorrow, I gave birth to my first daughter, who was stillborn at 35 weeks. She was perfect and obviously would have been able to live outside the womb had she been born on her own. I actually started having symptoms of depression and social anxiety disorder and stuff approximately 6 months after her birth, having dreams at night where I'd wake up in the middle of the night screaming. My husband would wake me up. I would never remember what the dreams were about, but I do remember the dreams being very I wake up with a feeling of something was not finished, something was wrong. Started getting easier about a year out from my loss. I ended up getting pregnant with my daughter Ava, and pretty much the only help I really had was a lot of counseling. 2 to 3 times a week I would see my therapist, and the major cure was when my daughter was born.
One friend of mine in particular just He experienced a lot of friends of his dying firsthand. He was one of their medics, so a lot of his friends, died while he was trying to help them, and that had a big psychological toll. He did end up getting in a really bad car wreck, probably like 2 months after he got back from his deployment. He had bought this like really nice Porsche and ended up sliding it right underneath a semi truck, taking off like the whole roof and just totaling it. So things like that, just reckless behavior.
The other thing that's important that I hope people will really begin to understand is that the prefrontal cortex is not fully developed until people are about 25. And who do we send to war? 18 and 19-year-olds. And, acquaint yourself with some of this. If you're going to be working with veterans, and maybe 1% of the population is now affected by people that have gone into combat. That's 99% that really are pretty oblivious.
I would say know the symptoms of PTSD outside of a formal screening. When people are being screened for PTSD from a doctor or nurse, they know they're being screened for something. So you're going to alter your behavior in that case.
Now, most of you nursing students will probably come in contact with a mother who has lost a child to stillbirth, miscarriage, something like that. You would be surprised, a lot of stillbirth mothers have PTSD. A lot of their deliveries were traumatic, causing the death of the baby. Some of them just, as myself, relive the moment of being told there was no heartbeat over and over and over again in their head, and sometimes it seems real. I would say if you come in contact with a woman who has had a stillbirth, treat her as if she does have PTSD and just reassure her as much as possible.
Nurses should try to train themselves to be aware of that. People who may have gone through a traumatic event, like something that would cause PTSD, might consider themselves too tough to ask for help.
This is going to be a really big issue in the future, but as long as the Iraq and Afghan war are going on, there's a lot of PTSD patients out there who are going to need quality long-term care, and it's a completely manageable condition with the right care and the right diagnosis.